Very, very excited about the conversation we're going to have today. Lisa Boson, who is going to be teaching the Certified Professional Health Coach Program, followed by the Certified Professional Master Coach Program, and then also the Specialist version, is here today offering you incredible background, experience, and expertise for just some great insight. Health and wellness coaching are fast-growing areas, very, very exciting what's happening in that space. And so this is a fabulous opportunity to really be aware of what the difference is between educating, training, and coaching. Lisa, thank you so much for being here and for doing this with us today. Please jump in and take over.
All right, thanks so much, Kathy. It is wonderful to be here, and it's so great to be part of the Center for Coaching Certification and being able to launch this certification program for health coaches, health and wellness coaches. So there we go. There I am. All right. So just a little bit about myself. I do have a clinical background. I was a respiratory therapist for many, many years and worked in most of those years in cardiac and pulmonary rehab. And yes, I felt like I was a clinician, an educator, and a trainer. And when I look back, I realized there was some coaching aspects to what I did. I also have an HR background and now work with individuals through different niches of coaching. So it's just great to be here to talk about, gosh, which hat to wear, educator, trainer, and coach. And you may find out that you wear one or many. So I do have, as we move forward, some ground rules for us. I do want you to participate today. So if I have questions, use the chat box to share, and also at the end, ask any questions that you have. There's a lot going on with health and wellness coaching and the healthcare industry, and I know many of you are probably interested in how do I become a health and wellness coach, and what does that mean, and how do I get started? I want you to stretch yourself, stretch your mind, let the good stuff in, and then celebrate that you are here with us today to learn about the different health hats that we wear of being a clinician, a health educator, a trainer, and also a coach. So to think about this, let's hear from you. And if you don't mind just sharing in the chat box, pardon me, let me go back. Do you consider yourself only a clinician? So in this group, we might have nurses or respiratory therapists or physical therapists or medical assistants, nursing assistants. Do you consider yourself only a clinician? Do you consider yourself only a health educator? I know I have diabetes educator friends. I have health educators that are certified as health educators, as a trainer. Do you consider yourself at least two of these? Or, wow, are you E? Are you all three of these? So if you don't mind just typing in the chat box so that we can see, are you A, B, C, D, or E, all three of these? And that will help direct this.
I'm going to add a couple of you if you want to add in that you consider yourself only a coach. Can we add that option?
Absolutely, only a coach. So
awesome.
Absolutely, just give us an idea of kind of where you are with your career and what you're doing with your professional life right now. That would be awesome. Thank you, Kathy.
So yeah, absolutely. So we're getting a couple of people to type in and to share with you. I've got a couple of people saying only a coach. I've got some people calling themselves trainers. I've got people saying at least two of these. And then let's see, wow, this is great. We're getting more and more. I've got somebody saying both coach and health educator, more on only on the coach side, coach and trainer side. So really some great combinations. This is excellent. Excellent. Okay. And help me out, everyone. I know, because I know some of you that are on this call, that some of you are in the health industry. healthcare professionals, health service provider, etc. We want to hear from you too. And if you want to just type in and name it yourself, do it as far as that goes. So we've got somebody that's becoming an LPC. So that's really cool as well. They're in process. So a great mix, a great mix. Thanks so much, everyone. Go ahead, Lisa.
Oh, that's great. That's great because this will help us direct this call and really talk about how it integrates, whether you're a clinician or already a coach and want to add this in as a niche. Maybe you're a trainer, a certified trainer by the ACSM. Lots of different opportunities and lots of different hats to wear, regardless of what profession, healthcare profession you're in. So thinking about this as I shared earlier, I think I'm E. I've been all three of these and at some point in my life and worn different roles of this. And one thing that came to light, we're going to be focusing on coaching but also talking about health education and training, is coaching is very specific, and we really want to talk today about what that difference is, because when I reach back into my prior life as a clinician working with patients over the long term, over 8 to 12 weeks of rehab, and understanding, now that I know what coaching really is, that it really is a subspecialty. It is a skill to be develop and understand, so that as you work with I worked with patients realizing, gosh, at this point, maybe when we're doing the classes on cardiovascular disease, that's health education. We are in the exercise room on the treadmill and with weights and patients wearing oxygen and on monitors. We're in the trainer mode. But then overall through this, there was the possibility, and it did happen and it does happen now, that there's a coach hat to wear to make sure that the coachee, the client, or however you want to describe it, or the patient, is really achieving the goals they want to achieve. So let's take a deeper dive into what we're going to accomplish today with our objectives. We're going to differentiate the roles of educator, trainer, and coach. We're going to know which role to use when, and then also understand how coaching helps your client or patient become active participants in self-care. There's a lot of words out there right now, a lot of processes and models in working with improving patient, they call it adherence or patient activation. But it's all about patients really becoming more active in their care and taking responsibility and accountability for their care, whether it's for chronic illness or for preventative care. But really, there's a lot of focus now on the patient population, clients, the consumers, becoming active participants in their self-care. And it's so important. Kathy talked about this in the last class, that the accountability, the ACA, really looks at including coaching as an integral part of patient and client care and improving patient outcomes. And there's a huge ROI that can be accomplished when you combine training and coaching. And lots of studies out there now on using coaching in the outpatient setting with medical assistance and clinic settings for diabetes education and cholesterol and smoking. So a lot of actions and research and actual outcomes on combining coaching with education and training. So let's look at how these differ, but then also how they support each other in helping clients become active participants in their self-care. So the first role we want to look at is health educator. Health educators. Some folks on this call are health educators, and we see these. There's lots of certifications out there for, say, certified diabetes educators. There's certified asthma educators. You'll see health educator being very specific. You also see health educators in the community we think about community education. And so we look at what a health educator is. And the definition is the teacher from which individuals and groups of people learn to behave in a manner conducive to the promotion, maintenance, or restoration of health and wellness. So we see this a lot of can be group education or individual patient education or client education. There could be health education in relation to, you see this a lot in hospitals that have orthopedic programs where they've got bone and joint education programs. You've got cardiovascular health education programs. You've got pulmonary education programs, but you're imparting knowledge and you're teaching people information. So let's look at when to be an educator. When a client wants information and knowledge to make informed decisions to improve his or her health, or when the educator determines there is a knowledge deficit. So this is about teaching and imparting knowledge. So we have different folks on the call today. We have individuals who are learning very specific knowledge about physical therapy. There could be different types of knowledge in regards to, again, the top ones, you know, smoking, diabetes, cardiovascular disease, bone and joint health. But where is that knowledge deficit and what is it? And so either the client may come to you and say, hey, I want some information about my specific disease process, or maybe how to reduce risk factors, or how to maintain my standard of health, okay? Or the educator may determine there is a knowledge deficit and sees that they need to do some patient teaching. I come from acute care. A lot of my background is in acute care hospital associated with rehab, and so we would see, for example, the Joint Commission requiring that patient education start very soon and early in on the admission process. So educators absolutely determining where there's a knowledge deficit and getting training in before discharge. And part of discharge planning, starting day one and including health education as part of that discharge planning process to reduce hospital readmissions. That's a huge indices that they're looking at now for hospitals, and they're being held accountable for. So health education is huge and part of that. So how to be an educator, okay? You will see this if you're already a health educator. It's pretty formal, okay? There's probably an appointment. There's a time set aside for that client or patient as an inpatient or outpatient or as a group. You see this with group classes that are being offered at community centers, outpatient centers at hospitals, even part of senior centers. Fitness centers have group education programs. There's a structure. It's formal. It includes a set process for sharing knowledge and determining retention and application of information. So for a lot of educators, I know I had to do this. Kathy and I were just having the discussion earlier about, you know, being an educator and how to impart that knowledge, and it's a process of determining, you know, understanding objectives and content and readiness to learn, and a structure of whether it's a didactic or a lecture or using examples or stories, okay? So there's a set process for sharing that knowledge. The understanding as an educator is that you are the expert in teaching the knowledge and teaching the content. So in thinking about this further, you're actually in a position of power as the expert in teaching the content. The client, the patient, sees you as the expert. That's an interesting concept to think about, because we're going to look at that position of power when we come to being a trainer and a coach. But you're essentially in a position of power as the expert, regardless of whether you are the expert as the physician providing patient education, if you are the nurse or the physical therapist or the diabetes educator, you are the expert. Okay, and more than likely you may have certification specific for that knowledge area. So the educator determines what needs to be learned. Okay, so this might be a formal assessment, maybe questions, it might be a checklist, but you really determine where the knowledge deficit is and what you're going to teach. Okay, now when we think about Educator for community education programs, there's an overall knowledge of where that community deficit is going to be, that maybe there's new content coming down the line for spine health or for cardiovascular disease, diabetes education, cancer prevention, okay? But as an educator, you say, hey, I'm going to create a program because these new programs, this new research, these new outcomes need to be shared with either the individual, the group, or the general public. So our processes are, there's assessments and inventories. Assessments and inventories, there's discussions, there's finding out what people know. There's methods, content, and objectives. So for many health educators, there may be brochures, there may be objectives, there's going to be concrete methods in which you are imparting the knowledge, okay? You may use online education. Gosh, a lot of groups, multi-specialty groups, the larger groups, are using online programs to educate their patient population and their clients. It may be one-on-one, it may be group sessions, it may be, again, you may be outsourcing and using different platforms for educating and imparting knowledge to the patients and to the clients. It's a very specific format to it, okay? And you determine styles of interaction. So, and paying attention to the client and the client's learning style. So we've all learned things like, visual learning style, auditory learning style, and so forth. But then there's also the styles of interaction that relate to online learning as well. For example, today, this is a style, this is a delivery method, and just one of many that you may find yourself using as a health educator. So also looking at learning styles of the client or the patient. If you're doing group learning, okay, you're going to be determining the norms kind of as groups, especially, for example, when I worked in cardiac and pulmonary rehab, we had patients that we would see for 6 to 12 weeks. So there would be group norms, just like the forming, storming, norming, and performing groups. You'd actually have some of this as you start building. You have these education groups. You have dynamics, okay? You have personality dynamics. You have communication dynamics. And then also the climate of the group and the environment itself. So lots of things to think about when you are a health educator and the process for delivering that, as well as interventions, okay? Certainly group interventions you see this a lot in families and with consulting and with moving an individual forward, but absolutely using interventions as a way to impart knowledge and help a client or a patient or family member in some cases move forward. So thinking through the processes of health educators and what you do as an educator to impart that knowledge. So I want to look at this from an example because it has a defined beginning and an end. And education is not ongoing forever and ever, amen. It is absolutely has a defined beginning and an end. It might be a one-time session. It might be subsequent sessions. But health education generally does not go on for a long period of time. The educator determines the beginning and the end, and this is very important to remember, that the health educator in this determines when it starts and when it ends. So looking at this example, our patient, our client, John, is being discharged from the hospital after having 2 stents placed in his heart, and the doctor has ordered cardiac education for the patient, okay? So again, we have an order for, and you'll see this a lot, ordered cardiac education for the patient before they become discharged. So as a health educator, you meet with the family and you gather information about the patient's client, the patient or client's diet, exercise, sleep, look at the medication regimen they're going to be discharged with, and other baseline lifestyle information, okay? Symptom information, that's very important. So really, in most health education, clinical educators for cardiac rehab or cardiac education have a very specific kind of formula that they follow. There's a checklist, okay, and determining, you know, what all is going on with the patient, client, family support services, ADLs, activities of daily living. So gather all this information so that you can then, as a health educator, tailor the session to teach the family about various aspects of post-stent care, including diet, okay? A lot of times it's very specific based on it's the DASH diet, low sodium diet, whatever type of diet the doctor will prescribe for that patient. Exercise may or may not include outpatient cardiac and pulmonary rehab. Symptoms to watch for, managing weight, looking at blood pressure, fluid retention, all sorts of things to watch for, okay? And then you ask clarifying questions to determine comprehension and understanding. This is just one example of how education works and the education process works, okay? Thoughts, questions on this before I wrap this up with some final questions that will help you determine if you are educating. Thoughts or questions?
Yeah, so do type in the question panel, everyone, and we'll share that with Lisa. Lisa, I've got a couple of people saying they're good, they're on track. And for those of you that have questions, what do you want to know? Lisa, the feedback I'm getting in the question panel is they're good. They're good.
Okay, awesome.
Keep going. They're loving it.
Thank you. So, okay, so as an educator, you may ask yourself, what does the patient or client need to learn, okay, based on your assessment, okay? So is it a cardiovascular assessment, diabetes assessment, spine health assessment? What does the patient need to learn? Readiness to learn is huge. If you are a health educator already, you know there's this, concept of, is the patient client ready to learn? Or does it need to be moved to family members to help support that patient or client in understanding the information? What are my strategies, interventions, and programs? So you are creating, you are the creator, you are the subject matter expert. What are your strategies, interventions, and programs? And finally, how will I know the client has learned the information? Because more than likely, if you're health educating in a health care organization, if it's a hospital or a physician's office, or for example, I go to a chiropractor, they're doing their checklist as well and identifying, did I learn the information? Did I ask questions? Did I answer correctly? And how do I identify if I learned that is a test? How do I know the client has learned the information? So in addition,
and Lisa, actually, as you've gone through that, a question came in, and I think this will be a great example.
Okay.
It is, should we educate if a doctor has put them on a diet, say a kidney-specific diet for kidney failure? So is that a time for them to be the educator?
That is a time to be the educator. You're putting your educator hat on. If you are the subject matter expert, absolutely, that is the educator, okay? But we'll also talk about that. I want to keep that in mind. I'm going to make a note of that because we'll talk about wearing a trainer hat and a coach hat for that, okay? So,
and I love this, and Lisa, I want to highlight one of the pieces you said. if you are the subject matter expert. Because, of course, the big concern here is probably, okay, liability factor, et cetera. If I'm educating somebody, I'm teaching them, telling them what to do, I want to make sure I've got the expertise that I'm really qualified for that education. And so, yes, a specific level of experience in education, and it is different than coaching.
Absolutely, absolutely. So that is a great point. The first question to ask is, do I have the subject matter expertise to impart this knowledge to the patient or the client? So that is great. I'm so glad that you mentioned that. Absolutely. And that was a great question, and I'd like to reference it as we move forward. So when is education best? When knowledge is required to help the client and her family make good healthcare decisions. And in this case, a renal failure diet, a renal diet is a challenging diet. I have some multiple friends on a renal diet, and it is challenging. So, and then you want to make good healthcare decisions. So knowledge is required. When the patient or client is ready to learn, and those are the two components. And I would add to that, absolutely, when it's education is best, when there's knowledge, and for you, if you're putting on that health educator hat, if you are the subject matter expert, or is there someone else that might be better suited for that health education? So to wrap this section up, if you're assessing what your client-patient knows, you're sharing knowledge, assessing the learning, using a feedback loop, then you are educating, okay? All right, so let's move to health trainer, the health trainer, absolutely. So I know we have lots of opportunities and for training in the health and wellness arena in the industry. And some individuals are very specifically certified fitness trainers, ACSM trainers, and so forth. But we also may be training for very specific skills that a patient or client needs to help themselves and become, improve their self-care. So as a respiratory therapist, I can say this because as a trainer, we may be training people how to do a jet nebulizer at home, or we're training individuals to do pursed-lip breathing. So let's look at, now let's put that trainer hat on, and what does that look like? So the health trainer, by definition, is the action of facilitating a person learning a particular skill or a type of behavior to improve aspects of health and wellness. Okay? So it's very skill specific. The patient or client is doing something. Okay? So the skill might be learning how to administer their own insulin. Okay? It might be a skill of learning how to determine their own level of fluid retention. So lots of different, or it could be skills that are specifically rated to like exercise, improving blocking skills or stability skills. So when to be a trainer is when a client wants specific information, instruction, or when the trainer determines there is a skill deficit. So if you realize, so we have knowledge for the educator, and for the trainer, it's about skill, okay, an absolute skill. So thinking about education, diabetes education might be, what is diabetes? What are the what does it mean? What's how do you measure blood sugars? How do you look at it long term? But then the skills associated with that may be directly related to, say, medication administration, skills of even portion control if you're teaching diet, so very specific skills, observable skills, things that you watch and assess. So how to be a trainer? The structure can be informal, could be just-in-time training. It can be formal, where and going back to just-in-time training, you may be working with someone, you may be in an education session, and something the patient or client says jars your memory, and you may take a moment and be in a training hat mode and just say, you know, I would like to see you perform X, Y, and Z, okay? And so that would be just-in-time training because it's there, it's in the moment, and there's a need for it. It could be formal, okay? So, for example, going back to my cardiac and pulmonary rehab, that's formal. You go a set number of days, a set number of minutes. There's a process. There's a structure to the assessment. There's an evaluation. It's very, very formal. The trainer, you are still the subject matter expert, okay? So you have expertise in whatever it is you're training, whether you're a respiratory therapist and you are training in inhaler instruction, maybe in home care ventilation. You are the subject matter. You're teaching a mother how to suction her child who's on a ventilator at home. You are a trainer. Maybe you're training in exercise, and maybe you have specific expertise with women over 50 who are postmenopausal. So you are some type of subject matter expertise. So we're looking at, you know, taking an inventory of your professional self, maybe thinking about what is my expertise, okay? It could be broad. You know, I'm an orthopedic nurse, I'm a physical therapist, I'm an LPN that focuses on, say, for example, renal patients. But where is your expertise? And as a trainer, you are considered the subject matter expertise. The client-patient is coming to you for your expertise. And you determine the instruction or the skills, okay? You're working through your assessments. You could be doing as an exercise trainer and certified trainer. You're doing fit testing. You are doing a step test. You are perhaps evaluating for range of motion. So you have a set kind of bucket of tools that you're bringing to the session to determine the instruction or the skill, what is needed. You're making recommendations, okay? And so when you look at that process, you're identifying a skills gap, okay? Whether it's, you know, how the patient is, you know, providing insulin, or are they going to be wearing an insulin pack? You know, are they, if you're looking at their walking skills, what their gait is, their stability, are they getting their heart rate up? Do they have taking into consideration, do they maybe have a pacemaker? So you're taking that into consideration on what your program is going to be. You're going to be delivering the training because remember, you are the subject matter expert, okay? So you're delivering it. You're doing the show and tell, okay? You're doing the observation. You're working with that patient or client, okay? So for example, in physical therapy, if you're partnering with a chiropractor, you're going to be delivering these in training, and the patient or the client, customer, whatever you want to call it, in flexibility and cervical traction and whatever it is. You are delivering the training, and you're observing the skill. You're giving feedback. Yes, you're doing it right. No, let's you know, create a little bit more curvature, and that's fine. Let's use you know, an aseptic technique for this type of a skill. It could be even wound care. You could be a trainer in wound care because you're teaching a family on how to manage and care for wounds at home. So you're observing the skills gap. You're delivering the training. You're observing the skill. You're assessing the level of competence. You're saying, great job, or let's do it one more time and focus on, maybe, I say it again, aseptic technique or whatever it is. You're going to retrain if appropriate, absolutely, okay? So for example, if you're in outpatient rehab and you're teaching your patients and clients how to use weight machines throughout their cardiac rehab, or maybe as you observe and assess the level of competence, you say, you know, let's not do the machines. Let's have you do chair exercises with weights. Those may work better for you. So you're retraining or revamping the process if needed because, again, you are the subject matter expert. And training has a defined beginning and an end, okay? And it depends on what you've identified as how to determine when the ending begins. When they're completely proficient at their training skill, okay? Maybe if they're in rehab, they've met the goal that you've set for them, whatever miles per hour or whatever METs they need to meet. The training has a defined beginning and end. It is possible that insurance determines your defined beginning and end. That can happen. But again, it's because it has a defined beginning and an end. So looking at this healthcare training example, so I'm going to put my respiratory therapy hat on. Gosh, I love that profession, and it is Respiratory Care Week, so yay to that. Sue has been recently diagnosed with asthma, and she's been admitted to the hospital through the ER 3 times in 2 months. So if you're staying abreast of healthcare changes, this is not appropriate in this day and time. Hospital readmissions are like a big no-no. So what do we want to do with Sue? Well, while she's in the hospital, you observe that Sue is taking her inhalers incorrectly. You ask the physician for some asthma education and training, okay? So you teach her about asthma, what it is, okay, what happens with the narrowing of the airways and the inflammation and the difference in the different types of medications. But now you're going to actually train her on how to take her inhalers again and offer tips and techniques for improvement, okay? Or as you look at this, you might say, gosh, a traditional inhaler, she might need a different type of medication administration based on how she's administering her own medication. So as you can see, you're doing an assessment, you're doing an observation, okay? You're training, you're re-observing, you're offering tips and techniques, you're determining if she's proficient, and then you kind of discharge her from training. You assess her level of competence. You ask yourself, is she administering her medications effectively according to protocol? Okay? It's yes, no. Okay? Desired result achieved, or no. Retraining may be appropriate or is appropriate. Okay? Or looking at alternative ways to deliver the medication. That's always an option. Okay? So as a trainer, you're going to ask yourself, what is the skills gap? What's happening? What are you observing? How do you know that for sure? Because they're demonstrating it. You have a set protocol. You are the subject matter expert. So you know if it's right or wrong. It's correct, incorrect, proficient, unproficient. What do you have to offer? Okay. How do you best support skill development? Okay. Training, retraining, determining if there's alternative methods. And how will I know when the trainee is competent? Okay, is proficient. Okay, and how can training help this person? So some things to ask yourself as a trainer. Okay, and what is the best way to train? So again, there's different ways to train. Okay, there's lots of videos, lots of handouts, return demonstration, what's the best way to train? And then again, is it best we think about best ways to train is the environment for training as well. Okay, is there may be phase 1 of training, for example, in the hospital or in the patient's office during an office visit. It may be require ongoing training and, post initial assessment and training. So when is it best? When you want to provide information and provide exercises to practice, okay? So you're going to tell them what it's for and why it's important, but you're actually going to be showing them what to do. So, and exercises, I'm using it in the broadest term of exercises being not just physical exercises. For example, the guy down here is training for tennis. Specific exercises, but this also has to do with exercises to do for improving patient adherence, patient activation, and compliance. And so it's, exercises for skills as well. Fill a skills gap. and share advice or expertise, because remember, you are the subject matter expert. Absolutely. Okay? So you have had some additional training, you have education in that area of expertise, you have ongoing, you study for it, it's your kind of like your passion, okay? It's what you know, and it comes to you to share information. So if you are planning ahead, okay, you know, our respiratory therapist planned ahead. She noticed it, she called the doctor for education, and she planned the session. Okay, what are you going to do? Let's talk about, you know, what's going to happen during that training session. We're going to talk about asthma, but I want to see you also, we're going to use a placebo inhaler so I can watch you do your inhalers. Define objectives. What are we trying to achieve during that training session? And you are defining the objectives. And that's very important as we move into what is happening with coaching. You are defining the objectives. You're working from your own agenda. You have your own agenda because in healthcare this happens. There are protocols. There are disease management protocols. There are ways to do things. Okay? There are best practices. There's research. You are working from your own agenda. You're defining the desired result. And you're designing the plan. Okay? And imparting that knowledge. And then finally, you are assessing competence. Going back to that, yes, are they doing it correctly, or no, do they still need some help? Yes, are they following their exercise training plan prescription that I gave them, or no, they're not. So you're assessing competence. So we have 20 minutes left in our session to talk about health coaching. So I hope you are continuing to ask questions in the chat box. So we'll have a little bit of time at the end to take Q&A. But I want to walk through health coaching. So wrapping up training, your training, if you're planning ahead, defining objectives, working from your own agenda, defining the desired results, designing the plan, imparting the knowledge, and assessing competence. So let's see what happens when you are the health coach. And it is possible to be all three of these in the work that you do with clients and patients. So for health coach, let's talk about health coach. Coaching is a strategic partnership in which the coach empowers the client to clarify goals, create action plans, move past obstacles and achieve what the client chooses. Now we choose in this session to use the International Coach Federation's definition of coaching because they are the gold standard for coaching. And in the prior session, Kathy did a great job of working through those 11 competencies for the International Coaching Federation, of understanding what those skills are and competencies for coaching. And applying that to the health professional relationship with the client, okay? Because this is different. We look at this. The coach is empowering the client to clarify their own goals, create their own action steps, move past obstacles, and achieve what the client chooses. Gosh, doesn't this sound different than the educator and the trainer choosing what the client wants to do, what the client needs? Let's take a deeper dive into this coaching. So when to be a coach? We're going to use the same format we used in the other two. When the client desires change, wants to improve performance, wants skill development, and is ready to engage in their planning and setting of goals, okay? So, gosh, difference here. You know, the educator is determining what the change is, and the trainer is determining what the skill development should be. Here, we're really looking at the client or the patient wanting that change, wanting to improve performance, wanting skill development, and is really ready to engage in their planning and setting goals. You know, I look back probably 10 years ago when we got this readiness to change and readiness to learn. And that is huge because we all know that if a client or a patient isn't ready to learn or doesn't want to set their own goals, you're not going to get anywhere with them. So, gosh, when to be that coach? When the client wants change, wants to improve performance, wants that skill development. You know, sometimes we think about coaching as being more like a sports coach and being, engaging and exciting and really motivating, and certainly that is part of it. But the bottom line of when we really look at the core coaching and how it really aligns with that gold standard of coaching, it's very always client-focused, 100% client-focused on creating their own plan, strategies, and goals. So the structure is co-creating the process, okay? You are working with the client, with the patient to co-create the process. The coachee is determining their focus, goals, and action steps. So this may come across as very open-ended questions. What do you want to focus on today during our session? What are your goals for cardiac and pulmonary rehab? Okay. What are you willing to do? What are you committed to do to reach your goals? Rather than as a trainer writing out a prescription, a coach is going to ask. It's all about questions and being the accountability partner. So versus imparting knowledge, observing, creating, and writing and subscribing and coming off your own agenda. You are asking questions, and sometimes those questions are deep, and they're powerful, and they create awareness. Awareness on what we're doing as a patient or a client to help us move it forward. But also acting as the accountability partner, okay? Helping that coachee, that client, that patient understand how they're going to maintain their accountability and staying with their own plan and their own action. So the coaching process is questioning, sometimes deep questioning, sensitive deep questioning to get to that awareness and create awareness. Positive and encouraging. Okay, going back to, yeah, you can be that sideline coach of positive and encouraging, but that's not 100% of the coaching process. Questioning and creating awareness, okay? Gosh, I think about, even in my own, as we've worked through this and through these two the certifications with the Center for Coaching certification, it's developing questions and really listening, developing the skill of listening to the client and then taking them to the next level so they go, wow, gosh, I hadn't thought of that. To me, one of the best feedbacks as a coach is when a client says, that's a great question, I hadn't thought of that. That's huge. That's a huge moment of awareness for someone to be able to move forward. Focusing on the future and achieving goals. Now, something that Kathy did in the last session was all about what's the difference between coaching and maybe what it's not in relation to being consulting and looking or being a counselor and really looking at the past. The coach always looks at the future and achieving goals. It's positive language, focusing forward, what you will do, what a client will do, what they're committed to do, and focusing on helping them create positive language for themselves. And the coaching questions are open-ended, okay? And so the coachee chooses the session frequency and the focus. You recall when we talked about educator and trainer, you are the subject matter expert, and you are determining what knowledge needs to be imparted and when that session will end. Gosh, with coaching, the coachee really chooses the frequency. Could be once a week, could be twice a week, could be ongoing for 6 months, couldn't be intermittent, and the coachee always determines the focus of the moment, being in the moment and focusing on what they want. So we think about coaching, absolutely you can wear this hat. If we're looking at just coaching, it's very open-ended, and it's always open-ended when you're choosing to use the coaching hat as a healthcare professional with your other roles. The length of the coaching relationship is open, okay? So thinking through this as an example, we have Sue. She's frustrated with her weight. Oh, my heavens, I can relate to Sue. Okay, Sue hires you to help her create a weight loss program and to be her accountability partner. So during one of her coaching sessions, she shares one of her barriers is attending parties and events. So you're her coach. You're helping co-create a weight loss program, okay? It is possible during this session, if you are a subject matter expert, you may take your hat off and give her and help her brainstorm some ideas of what are best methods and tools for her to create her own weight loss program. She's continuing to work with you as her accountability partner, and during one of her sessions, she says, you know, one of her barriers is attending parties and events, okay? So you work with Sue to identify her own strategies to attend parties and other events. You may start a brainstorming session. Gosh, you know, I'm gonna get her permission to brainstorm and say, gosh, let's take some time and work through some strategies. You get started, I'll throw in one, you give me one, I'll give you one, and then we'll prioritize and see which ones will work for you, okay? So Sue is identifying and saying, gosh, you know, we came up with 10 ideas, but I picked these 3 that I think will really work for me, okay? So it's possible to be the subject matter expert as a health coach, but what's really important as a health coach is the dialogue, is the questioning, okay, and moving Sue toward her own conclusion. Coaching comes from the concept that the client, the coachee, the patient is their own best expert. They know what will work for them. They can gather all this information of when you've shared information as a trainer or as an educator, but they know what will work for them. The patient, the client, the coachee knows their own barriers, understands their barriers, their resources, what they can and what they can do, what they can have as a stretch assignment. They are their own best expert. So with that, then Sue says, gosh, we brainstormed 10 ideas. These are the 3 that can work. She sets a timeline to implement the strategy and a time to report back on her results, okay? Very different than if you were the educator and the trainer writing out their own plan, their own strategy, their own course of action. Gosh, Sue's out there creating her own and being proud of it, taking accountability for it, and taking ownership for it. So as a coach, you will ask yourself, what questions can I ask my coachee to help him or her come to their own conclusion or conclusions? How can I inspire him to improve or her to improve performance? How can I support my coachee in developing personal accountability? So when is coaching best? When the individual is self-motivated, okay? They're coming to you and asking you for help, okay? There is time for development, absolutely. There's support and training. It's used to support training and education initiatives. So this is important because if you're a health educator, it's very possible for you to use coaching questions and the coaching process to support education. Gosh, here's the knowledge I'm going to impart with you, okay? I'm a subject matter expert in diabetes or cardiovascular disease or primary risk prevention, okay? So I want to put my coaching hat on and let's co-create a plan to help move you forward. So it's great for combining with training and education, but it's a very definitely different hat that you are wearing. The client is ready to set goals and move forward. And there's opportunities for strategy development and brainstorming. And a desire to enhance engagement and self-care. So it's client-focused, it's client-driven, and because they're open-ended questions and you're asking questions to move that client, the patient forward. It really depends and it relies on the desire for that patient or client, coachee, to enhance their engagement in self-care. So if you are aware the client is their own expert, yes, you can be a subject matter expert, but being aware the client is their own expert, that you're asking short, open-ended questions. How will you do this? What are your resources? Lots of hows and whys, and very few yeses and no checklists. You're staying forward-focused, minimizing the whys. Why did this happen? You're completely open to possible outcomes because you're not working off of your agenda. You're working off of the client, and you're focusing on the individual. You're releasing your own agenda and allowing and having the client set the agenda. And I'm going to go back to that position of power because there's wonderful research out there on the position of power that a healthcare professional has coming into the room with a coach, a coachee, a client, or a patient. You are removing that power. You're recognizing and accepting the individual where they are at, then you are coaching. So we have about 5 minutes for questions and answers. So as you put your questions and comments into the section, I'm going to go into the overview of health education session. You're teaching an individual group focusing on sharing knowledge, using methodologies, assessing comprehension, and feedback loop. For training, you are focusing on assessing a skills gap, teaching skills, and leading or providing exercises and observing and providing feedback. Health coaching, you're using open-ended questions, defining goals, considering challenges, resources, creating action steps, developing accountability, and celebrating. Because remember, I told you at the end of the session, ask you to celebrate that you are here today and learning. I have some test your knowledge questions, but I want to ask Kathy as our moderator, should we go through the test your knowledge or take questions?
I've got a couple of great questions at the same time. Lisa, let's do this. Go ahead. I know you just have a few things left, and then I'm going to feed you a couple of questions that have come in. They're really good. So go ahead and wrap up here.
Okay, so we have a test your knowledge. Dan has been struggling with cycling on higher inclines for the last 3 weeks. He's complaining his legs are fatiguing too quickly and he loses momentum. What type of session is most important or is most appropriate?
And for your guests, everyone, type in whether you think educator, trainer, or coach is the right professional for them. Please put that in the question panel. So I've got a couple of people answering. A general consensus on this one seems to be trainer. That's what I'm seeing most.
A+. Okay, so in the essence of time, I'm going to move to the next one. Becky is caring for an elderly father with COPD. She has limited knowledge of lung diseases and is not sure how to help him at home. What type of session is most appropriate?
So same thing, everyone. Type it in, education, coaching, or training. And you have a consensus on this one for education. That's what I'm seeing most often in your responses.
Awesome. Thanks so much. Absolutely. Education. Let's give her some knowledge about lung diseases, symptoms, what COPD is, what she can expect. And then coaching and training may be appropriate after that. So the last one, Katrina's weight has yo-yoed over the last 10 years. She's tried several weight loss off-the-shelf products and has difficulty maintaining a healthy weight. She wants an individualized program that she can do on her own. What type of session is most appropriate?
All right, Lisa, I'm already getting answers. They're way ahead of you. And I've got a couple of different answers on this one. The consensus is coach. That's what I'm seeing the most.
Yeah, coaching is absolutely would be appropriate because she wants an individualized session. Certainly, education can play a part in it, but it's that key word of individualized program that she can do on her own. She's motivated. She came to you. Certainly, you may ask some educator, what have you done in the past, but she told you. So let's move forward and help co-create a plan for her. Awesome job. Okay, so I think we're at Q&A, Kathy.
Awesome, awesome, good. So one question that came in was, how do I prepare for the different roles?
Oh, wow. You know, okay, easy way to prepare for the roles, and I'm guessing what you're telling me is thinking about, you know, before you dialogue with the patient or have the session, think about those questions that I shared with you. You know, is there a knowledge deficit? Is it a skill deficit? You know, is the patient's or the coachee's readiness to learn? Are they wanting to, are they coming to you and say, create something for me? Okay, which you put your trainer or your educator hat on. Or are they coming to you saying, I really want something for me. I want to work on something that will, you know, individualize it, really work it for me. So there are some questions you can prepare yourself in your head to think about that whole awareness of what is, and really listening to what that coachee, that client, that patient is saying and asking. And then what are you doing? Are you assessing? Are you, you know, working off of your own agenda, or is it a situation in which you release that and work with in the co-creation process? And one other key point on this, Kathy, and you brought up very well, is that are you a subject matter expertise, are you expert in that, and how will that play a role?
Excellent, excellent. And of course, Lisa, the big piece for each of these roles is that experience and that education that you have for actually being the professional in that role. So awesome. Here's another great one, Lisa. How do you manage all of the roles in the same relationship?
Oh, that's a great question. And we talk about this a lot in the professional coach class and in the master coach classes. Because it's important that the client, coach, patient know which role you are wearing and which you are using. So asking permission, you know, if you're in the education role, okay, and I would absolutely say, you know, I'm putting my trainer hat on because we need to work through, okay, medication administration, or exercise, flexibility, and so forth. Very, very important. Absolutely, when you move into the coach, you know, if you're in the coach role or moving into the coach role, you know, I'd like to put, you can be as simple as, you know, I'd like to put my coach role and ask you some questions to create awareness, to have your permission, okay? And moving forward with that. So asking permission and moving in between these roles. So it's very clear to your client which hat you're wearing, which is the title of the session. Which hat are you wearing, and letting your client know which one you are wearing.
Excellent, excellent, awesome. And Lisa, just sharing with you, several people are saying thank you. They're really appreciating this information. You've got someone, I love this one because this is a great example. They are saying that this is excellent for letting healthcare friends enhance his ability as a healthcare professional. And then lots of thank yous and great session, etc. We have used up our time. Thank you everyone for being here. Yes, we will email you a link to the recording on the YouTube channel, so you can come back and check it out again, share it with others, pass it on. So definitely appreciate all of your questions, all of your insight, and looking forward to being of service to everyone. So thank you all.